Hello, this is a video on diabetes, the effects it can have on the body, and how you can possibly treat it. So what is diabetes? It is a group of diseases that affect how your body uses blood sugar or glucose. Glucose provides energy to cells and is the brain's main source of fuel. Chronic diabetes is either type 1 or type 2. Potentially reversible diabetes is prediabetes or gestational diabetes, which is while you're pregnant. Symptoms vary depending on how elevated your blood sugar is. In type 1, symptoms tend to become present quicker than in type 2 or prediabetes, which can include increased thirst, extreme hunger, frequent urination, unexplained weight loss, presence of ketones in urine, byproduct of breakdown of muscle and fat, fatigue, irritability, blurred vision, slow healing sores, frequent infections. Type 1 is most common to appear during childhood or adolescence, and type 2 is more common in people over 40. Causes. The pancreas secretes insulin into the bloodstream, enabling sugar to enter cells. Then as blood sugar levels go down, so does insulin. Glucose is a source of energy for cells that make up muscles and other tissues. This comes from two major sources, the food and your liver. Sugar absorbed in the bloodstream enters cells with insulin. Liver stores and makes glucose. Causes of type 1. The exact cause is unknown. The immune system attacks and destroys your insulin-producing cells in the pancreas. Instead of going into cells glucose, it traps in the bloodstream. Though it can be caused by a combo of genetics, susceptibility, and environmental factors, the weight not believed to be an issue. Causes of prediabetes/type 2. Cells become resistant to the reaction of insulin, and the pancreas is unable to make enough to overcome the resistance. Exactly why is uncertain. Genetic and environmental factors have been linked to type 2 diabetes. Causes of gestational diabetes. The placenta produces hormones to sustain pregnancy. These hormones make cells more resistant to insulin. Normally, pancreas just produces more, but sometimes it can't keep up. Risk factors. Risk factors of type 1. Family history, environmental factors, presence of damaging immune system cells, and geography. Risk factors of prediabetes/type 2. Weight, inactivity, family history, race, age, gestational diabetes, polycystic ovary syndrome, high blood pressure, abnormal cholesterol and triglyceride levels. Risk factors of gestational diabetes: age, family or personal history, weight, and race. Complications. Develop gradually. The longer and less controlled, the higher the risk. Cardiovascular disease, nerve damage, kidney damage, eye damage, foot damage, skin conditions, hearing impairment, Alzheimer's disease, and depression. Gestational complications. Most deliver healthy babies, however, some complications of the baby are excess growth, low blood sugar, type 2 diabetes later in life, death. In the mother, preeclampsia, subsequent gestational diabetes. Prevention. Type 1 can't be prevented, but some lifestyle changes can help. Eat healthy foods, get more physical activity, and lose excess pounds. Men versus women. Women with diabetes are more likely to have a heart attack. If they have a heart attack, they are also less likely to survive if they have diabetes than men with diabetes. The following are the sources I used to help me make this video. If you believe that you have any of the symptoms listed in this video, please go speak to your doctor as soon as you can.